Good evening, everyone, and thanks for joining us for tonight's program. This evening's presentation is called For a Clearer 2020, Tips for Healthy Sight. I'm Kevin Marks at KSB Hospital, and we appreciate your taking the time to spend with us this evening. This program is one of several that the hospital is offering on the census, human census, in terms of touch, hearing, smell, and taste. It is sponsored by the KSB Community Wellness Department, underwritten with assistance from the KSB Foundation. This evening, we're happy and excited to have with us the three doctors of optometry practicing at the KSB Wallace Eye and Vision Center, Dr. Peter Popovich, Dr. Emily Richardson, and Dr. Kelly Klein. We appreciate the time that they have put into preparing for this and are confident that you're going to learn a lot this evening. So Dr. Popovich is going to start us off. Welcome. Thanks for your time tonight.
Welcome, everyone. I'm Dr. Peter Popovich, and I'll be talking tonight about the importance of routine eye exams, not only for our eye health, but as well as our systemic health. To start off with, I just wanted to ask a question. Are the eye chart and glasses tests alone an eye exam? I think there are some misconceptions about these tests, that these are the eye exam. And so, really these are one part of a full eye exam. We may have had these, the vision tests, particularly at the DMV or school or at a pediatrician's office. However, these tests are looked at as more of a screening, especially the vision chart test as a screening tool rather than a full eye exam. First, we have visual acuity, again, which is a measure of vision. 20/20, I'm sure many of you have heard, is considered what is statistically normal for a person's vision. So whenever we don't have 20/20 vision, we're always looking for a reason for that. And so moving on to the next part of the eye exam, we have color vision testing and depth perception. Color vision testing is not only important for testing young kids for color blindness and color deficiencies, but it also is really important as we get older because we're on a lot of medications as well as developing eye diseases. And so the color vision testing helps us to detect progression of disease. In the lower right-hand corner of the screen, you'll see the depth perception chart. And we use this just to kind of identify how we're looking with both eyes and kind of our three-dimensional awareness. Visual field testing is really important. It's a test of our peripheral vision or side vision. This is extremely important in testing for eye disease like glaucoma that can destroy side vision permanently, as well as in conditions like brain tumors and strokes. And so we're doing these peripheral vision checks on every patient when they come in, and we really do find some surprising things at these exams. Next, we have refraction, which is essentially the determination of glasses prescriptions. And so your optometrist or eye care provider will be giving you different lens options to kind of optimize your vision. So I think we're all probably familiar with that test. And so far we've talked about some subjective tests in which patients are telling us what their experience is and what they're seeing. Next, we're going to move on to some objective tests where the practitioner is actually looking at the eye and assessing the eye health. So one of the most important tests is the eye pressure test that you can see on the screen here with the blue light. And this allows us to check for high eye pressure. And so in a similar way that high blood pressure is damaging to the structures of the body, high eye pressure also causes damage to the eye. And so in conditions like glaucoma and other inflammatory conditions, eye pressure can spike. And so it's really important for us to test for this. One of the things that people coming in sometimes aren't aware of is that eye pressure spikes typically aren't very well detected. And so at each exam encounter, we're always checking for that high eye pressure. Also, we use a machine called a slit lamp, and we use this to magnify and examine different parts of the eye. You can see that in the lower right-hand portion of the screen as well. We also have eye muscle and pupil testing. These tests are essentially function tests of the muscles and nerves in the eye. One thing is that the eye is connected to the brain, and so these tests are also letting us know how well your brain is functioning and how well that connection between the eye and the brain is working. And so we use these tests, and we're oftentimes picking up, again, things like tumors, strokes, just from these tests alone. So they are extremely important parts of the eye exam. Next, we have pupillary dilation, which is essentially where we put drops in the eyes, and this just temporarily paralyzes the muscles in the iris, which is that colored portion of the eye. And so what happens is that pupil enlarges and it gives us a bigger window to look at the back of the eye. Otherwise, it's kind of like looking through like the keyhole of a door. So we get just a very small snapshot of the eye health. And then finally, with that pupillary dilation, we're able to do our retinal evaluation. And so your provider will do a full exam with that slit lamp that we talked about, as well as a specialized headset. And we're able to examine the vessels and the nerves in the back of the eye. And so again, this is letting us see how the eye is working, looking for eye disease, but also because we're seeing blood vessels and nerve endings, we're able to actually assess the overall health of a person. So finally, when should we be getting our eyes examined? Really, the first eye exam a person should have is at age 6 to 12 months. And so this allows us to detect eye diseases and eye conditions that we can treat oftentimes in young infants. KSB has a great program called Infancy, in which kids under the age of 12 months can come in for free eye exams. So we really encourage people in the community to take advantage of that program. The next recommendation for an exam is at between 3 and 5 years, typically around 3 or 4 before kindergarten. And then at kindergarten and every year of school, we're recommending annual exams just to minimize any obstructions to learning, as well as just looking for any kind of fatigue or eye strain that we're noticing in a lot of young kids from digital device usage. After school, we are recommending exams at least every 2 years. Although if you're wearing glasses or you have an eye disease or an eye condition, oftentimes you'll be coming in at a year or sooner. And then at age 65 or older, we're recommending annual exams. And this is really important because eye disease goes up exponentially at age 65. And so again, we're just encouraging everyone to try to follow these guidelines. And this is extremely important, just as we do wellness checks, that we are coming in for our routine eye exams. So I'll go ahead and hand it off to Dr. Richardson.
Okay, hello everyone. So that was a great introduction into what we do and what is done when you come to have your eyes tested. And I know going back to what we're talking about today was, tips for healthy eyesight. And, a big part of that for a lot of people is, what is blurry vision? What can I do to make my vision better? What can I do to see clearer, to see 20/20? And so what myself and Dr. Klein to follow me are going to talk a little bit about is some of the common causes of blurry vision. There are obviously a lot, ranging from, like Dr. Popovich said, those glasses prescriptions, simple fixes with glasses and contact lenses, ranging all the way to progressive retinal or eye health conditions. And so we're just going to touch on a couple of the common ones. But things, like I said, between refractive error, there's also what are called binocular vision dysfunctions, which are where the eyes don't, like Dr. Popovich said, with the eye muscle movements, they don't work together as a team, and that can cause double vision or other learning concerns. Dry eye is a common cause of blurry vision, conjunctivitis or other red eyes, cataracts. And then our other retinal conditions like macular degeneration, diabetes, glaucoma, those are all definitely things that can affect your vision. And so I know we want to touch on some of those more common ones that affect a lot of you out there in the public. So the first thing I'll talk about is I want you to ask yourself, do you ever have issues where your vision fluctuates from day to day? One day it's good, one day it's bad, or maybe, in the morning it's blurry and it gets worse throughout the day, or are your eyes getting tired and your vision getting fuzzy after you do a lot of reading or computer work for any length of time? Or how about how they're feeling? Do your eyes get watery or causing your vision to get swimmy or make your vision change during those activities? All of these are things that can be caused by dry eye. So dry eye is a very common condition, and there's a lot of symptoms for that, and that can be stinging and burning of the eyes. The eyes hurt, they don't feel good. You can have that sandy, gritty sensation. It can cause blurred vision that comes and goes. It's intermittent, it's not always there, but it's there when your eyes are hurting. Redness or pinkness to the eyes, and excessive tearing. Now, the tearing is something that I hear a lot in exams. No, doctor, my eyes aren't dry. They're really watery. They water a lot. I've got plenty of tears. And I will talk a little bit about how that actually is a sign of dry eye, and that's kind of a misconception. And so we'll talk about our tears here a little bit more. Our tears are more than just water. They're more than just liquid. There's actually 3 parts or 3 layers to the tears. So you do have the aqueous layer, which is the water, component of it. That's what's produced and what you see when you cry and what drips out. But there's also a mucus layer, which has some of its own self-protectants, for our eye. And then the lipid layer, or think of like the oils. And so the lipids are a really important part. Something we don't think about having oils in our tears, but the lipids are what prevent the tears from evaporating off the surface. So when we blink, our eyes, our oil glands that line our upper and lower eyelids release oils. And those oils sit on the outer surface of the eye to help hold our tears on the eye as long as possible. And so one of the most common types of dry eye is actually a lipid or an oil deficiency. So your eyes are not producing those oils as they should. What happens there, and this kind of gets back to what I was talking about having the watery eyes, is that excessive evaporation, the tears are evaporating off the surface and not staying there, actually stimulates us to produce more liquid because our eyes feel dry. And that overproduction of the liquid and the liquid layer of the tears is what leads to inflammation of the eye, irritation of the eye, and that can lead to some of those dry eye symptoms I was talking about. So again, there are other reasons our eyes can be watery, but one of the main causes for watery eyes is actually dry eye, and I know that sounds kind of confusing. One of the other things that can happen is, and I'll kind of go to the next slide here for this, is the oil glands. So here I'm showing you in the picture on the left is those little openings where our oil is produced right by your eyelashes. And those oil glands can get clogged up, and that's one of the reasons why we don't have enough. And so that can get thick and it can get cloudy, and that can lead to that evaporation. If we go even more to signs of dry eye, things that I'm seeing when I'm looking at your eyes with the slit lamp and those other instruments, is the picture where the eye is kind of lit up all green here. We put in a special dye in the tears, and that actually shows me where the dryness is on the surface of the eye. And so this eye here is showing all those little kind of highlighted or glowing areas are little areas of dryness on the front of the eye, and those are areas that can cause a lot of blurred vision. So imagine the windshield of your car, right? And that's supposed to be clear. You see through it, you want it clear, you keep it clean with the wipers. You blink, you keep your front of your eye clear. And when these areas are here, like little pits or little areas of excavation of the front of the eye, it's almost like you're covered with bugs on the windshield. You can't see through those. And so that can really lead to dry eye. So that's 2 reasons our eyes can be dry. 1, you can have too many tears, and those are kind of swimmy to see through. And 2, you could have these little areas of excavation, and that can be really hard to see through as well. And again, are all things that that we can see in our exam that are kind of correlating to the symptoms that you're having, and ways that we can try to treat that to improve your vision beyond just needing those glasses. As a side note, sometimes people don't understand. They come in for an exam and they want to get their glasses and they want to see 20/20, right? That's the goal. But sometimes we can't quite see 20/20, and this would be one of those reasons why. So I can only get you seeing, maybe I can't quite get you that clear. You're 2 lines reduced, and that's because when I look at your health, I see these little areas of pitting, or I see that your tears aren't right, and that would then be why. And so we'll work on that, and we'll try to get that better so you can see 20/20. Some people who have dry eye don't have necessarily all those signs, but you do have the symptoms. And so how are we going to treat symptoms? One common thing you might see, and you're looking at it right here in my picture, is you have that aisle down in the pharmacy of eye drops. There's so many different kinds of artificial tears and tear supplements and oil tears, and there are a lot. And I do recommend, when that's a very confusing aisle to be in, and that's where our expertise and your optometrist expertise or ophthalmologist can kind of guide you into what type of drop is appropriate for you. So if you have that oil deficient type of dry eye, let's get you a drop that supplements your oils. So there's different types of drops out there that we would use, and I think that's a really good reason why, because it's so confusing and eye drops can be expensive, getting that advice from your eye care provider would be appropriate. Unblocking those oil glands. So you saw on that last picture there, again, where they were all clogged up, see that little yellow kind of gland opening where it's clogged up and that's not coming out smooth, we can do things to improve that. So one of the things that's simple that we talk about for our baseline treatment would be to use a warm washcloth, get that warm, whether it be running it under water or heating it for just a few seconds in the microwave and not too hot it's going to hurt you or burn you, but to hold that on your eyelids and warm those oils up and allow them to become more like liquid, have less clogging of the glands, and then it'll express better. So that's one way to make your oils better. The other thing we always talk about is blinking more. So it's the blinking mechanism, right, that pushes that oil out. And so we don't think to actively blink, but by blinking more, you are going to be expressing those oils a little bit more frequently, and that can help then promote this and stimulate healthy expression of the oil glands. Sometimes those things aren't enough, and a lot of people have maybe seen, an eye care provider. They said, I've tried those compresses, those are hard to do, and I put the drops in as much as I can remember, but sometimes it's not enough. And so there are some advanced treatments that we can use and we can recommend to patients who still need a little assistance. A couple of very, very cool things that we do in our field, and I'm going to talk briefly about here. I've shown pictures of the one in the middle. It's a medicated drop. So there are some medicated drops to help those people that don't produce enough of the liquid part of their tear. And so that's one thing we can do, and that is to help reduce the inflammation of the gland that produces it. And by reducing inflammation, it helps it produce more tears. And so that's one thing, and those are prescription drops we can prescribe. Some of the other really cool things we can do, you're seeing someone over here on the left-hand side holding up something that looks kind of like a contact lens. So that's actually what's called a procara lens, or a harvested piece of amniotic membrane, and that's something that comes out, from when a baby is born, and so those are actually harvested, predetermined from a C-section, and they take that tissue. You think of a baby, they come out and their skin is smooth and they've got healthy skin, and that's because there's so many nutrients in that tissue. So we can use that tissue. It's incorporated into a contact lens, put on the front of the eye to help heal those areas of pitting and ulceration and excavation of the front surface caused by dry eye. Now we use those lenses for other things, infections and ulcers and other things, but it is something that can be used for dry eye when those other treatments don't work. Another thing you're seeing here, it looks like an interesting contraption that's attached to this patient's eyelids. That's called LipiFlow, and that's actually a warming, massaging mechanism that can be done to help express that oil that's deep in those glands that's not coming out with just your natural blinking. And so it's more of an advanced way to do those hot compresses to get those oils out. And so that's another thing that is accessible, through your eye care provider, and we have that accessible to us here in this community. So that's a really, really great thing. I'm going to kind of change gears, and the reason I brought up this next topic, this computer vision syndrome topic, is because there's so many people, especially now when we were talking about e-learning, and we're talking about working from home, and we're talking about using our digital devices so much more right now because we're trying to connect with family and friends and work all through the internet and through digital devices, and we're getting a lot of questions about eye strain and how does this affect our eyes. And so digital eye strain is a really common thing, especially right now in this time. And so computer vision syndrome is something that can cause fatigue, it can cause blurred vision, it can cause headaches, dry eyes, and it can cause a lot of, head and shoulder pain as well, or neck and shoulder pain, I should say, because of how you sit and how we function at the computer. So we like to talk a little bit about safe viewing of the computer. And so you can see my little schematic here. I always talk to people about, well, where does your screen sit? Is your screen, like right now, I'm looking over this laptop. I'm looking straight at you guys. But if I want to look down, I'm looking down towards my screen. So just naturally below your eye level is a great spot for your screen to be. So that's a little harder on a desktop, as you can see, but knowing that it's about 4 inches below your eye level is great for your posture and your ergonomics of how you're sitting. You might see a lot of people talk about, that they get neck aches because they're constantly looking down at their phone, right? Like we hold our phone in our lap, we're looking down, and that can cause a lot of strain, and it affects your eyes as well. Lighting is important, so we want to make sure you have proper lighting, and if your lights are dim in your home, or in your room or wherever you're at to bring your screen light down. That's safer for the eyes and healthier for the eyes. Using anti-glare screens to help prevent some of the glare that comes off, because when we see glare, we tend to kind of squint and focus, and that can cause a lot of eye strain in our forehead as well. I talked a little bit about seating positions as well, but you want to be sitting, in a comfortable position, especially when you're doing a lot of extended near work or extended computer work, because that can affect, ergonomics. We're talking about blinking again. So blinking is one of those things, make yourself actively blink. And that's something that's really weird. We don't think about that, right? But making yourself actively blink helps to replenish your tears and keep your eyes from drying out. And then taking breaks. I mean, we all know that if we do too much of one thing at one time, we can get really fatigued, and that can affect not just our body posture, but also affect our eyes and how well our eyes can see and function. Oh, I love this. So I've got this blinking more again, right? So you want to hold them closed to get those oil glands out, or you're blinking too much. Well, normally we blink, 15 to 20 times per minute. And on average, it's about half that much when we're looking at a digital device. It has to do with the pixelations of the screen and the focus and the light coming back from that versus a regular piece of paper. And so when we're reading on a digital screen versus printed material, we just don't blink as much. And imagine how important, I'm telling you, blinking is to your eye health and your dryness and making your good tears. That really causes a lot of strain. So obviously, remember these schematics of these funny people. Obviously, one's blinking way too much and one's blinking way too hard. But again, remember to blink. It's a kind of a funny thing, but it does help with your dry eye. We always love this. I think in the eye world, we like this schematic, 20-20-20. It's easy to remember, it's easy to say, but to prevent digital eye strain, remember that 20-20-20. Every 20 minutes, take a 20-second break and look at something 20 feet away. And that allows your eyes to relax. It allows the muscles, the eyes have muscles in them that help you focus, and it allows those to relax to provide. It's just imagine if you're holding a dumbbell and you're holding it forever and ever and ever. Eventually you have to let it down, shake it out, and then try again. And it's kind of a similar thing to prevent fatigue, to take those breaks. So remember your 20-20-20 rule. The last thing I want to talk about with digital eye strain is a kind of a newer, newer topic in the eye industry, and something that people are asking a lot of questions about, and that's blue light technology, blue light glasses. What is the blue light doing to my eyes? And so it's definitely still new, and there's still research out there about it. But I think, we all know that, and we've known for a long time, that ultraviolet light is harmful to the eyes. It affects the tissue inside the eye. It causes progression of cataracts. And so we know, we think about people going to the tanning bed or being outside, you should wear a hat, you should wear sunglasses to protect you from that. Blue light is in the visible spectrum. We see it, but it's the closest to ultraviolet light. And so studies are still going on about, well, how much damage could that also be causing? It's close to ultraviolet. It can be affecting your eyes. And imagine, we have these young children now on screens and doing all this stuff and not really knowing how it's going to affect their eyes later down the line. And so blue light technology are lenses or screen protectors, things that can block that blue light and help reduce eye strain. So they come in the form of glasses. They can come in the form of screens on your devices. You maybe have seen on your phones, you can turn the blue filter on, and it kind of dims your screen a little bit to block some of that light. All those things are things that, why not do something to help prevent that strain that you could be getting? The other thing that I was going to say with that was that, sorry, I lost my train of thought for a second. With the blue light, there also are some contact lenses on the market that are coming out now to try to prevent digital eye strain as well. And so transitions that, when your glasses turn to sunglasses, they have those in a contact lens form as well now too. All of these new technologies are trying to help prevent strain, protect our eye health, and help us see clearer and more comfortably with our vision, for a long period of time. And so I know I just touched on a lot of those topics briefly, so if there are any questions, let me know, but I'm going to go ahead and turn it on over to Dr. Klein to talk about some other things.
Hello, everyone. Kind of switching gears a little bit, Dr. Popovich was talking about why the eye exam was so important. I wanted to speak a little bit about what we can find during the eye exam, that we can discover what might be making your vision not as clear, and ways to make it more clear. It could be a little bit blurry due to cataracts. So the red arrow here on the screen is pointing to the lens of the eye. And that is where the cataract forms, where the red arrow is pointing. The lens of the eye there normally ages on all of us. And so if we live long enough, we will all get cataracts. I think sometimes patients think that this is a horrible word and a horrible diagnosis, but if we live long enough, we will all get cataracts, just at different ages. So sometimes people have them a little bit younger than others. I kind of think it's like gray hair sometimes. So the cataract is the picture here. We have a clear lens that it would be maybe when we were born. And then the bottom of this image is a cloudy lens that happens over time. And the damage to the lens is caused by natural age, oxidation, UV light, what Dr. Richardson was referring to, why that's important to protect ourselves from UV light, and other things that age our bodies. Things like smoking can cause that lens to age prematurely as well. I think the question I have here is what does that mean? We hear the word cataracts all the time, and a lot of times people don't know exactly what that is pertaining to. So there are a couple types of cataracts. The most common type there is in the center, and that is the yellowing of the lens that happens with aging. And there are different types that are in these pictures that cause different degrees of blurriness. And the yellowing, the center picture, is the most common, kind of with age related, but the other ones can be caused by age as well, or things such as having trauma to the eye, even years ago, can cause a cataract to form as a result of that trauma. And using certain medications can cause these cataracts to form earlier in some people. So if you do have the cataract, if you have the diagnosis of cataracts, that is something that we're going to monitor yearly at your eye exam, and sometimes even sooner than that. Sometimes we might ask you to come back in 6 months. Usually the cataracts do progress slowly, but that's something that we want to keep checking and see how it affects your vision. Patients that are affected by the cataracts notice blurred vision, sometimes filmy vision, foggy vision, or glare when they're driving. So those are some of the things that patients may notice with these. So in order to see more clearly, oftentimes it's necessary to have the cataract removed. So we thought that would be interesting to talk about. Tips for a clear 2020 is a little bit about the process of having the cataract removed, what that's like, and how that can improve your vision. The cataract removal is an outpatient surgery that does not usually require general anesthesia, and it can be completed in a relatively small amount of time. And I added here that you'll bring a driver to your surgery, because that you are unable to drive home then after the procedure. But it is something that you do not stay overnight in the hospital for, and you're usually there kind of just in a few hours total. So within the surgery, it's interesting. It is a very small incision that is made, much smaller than it used to be years ago, because there have been a lot of advancements in cataract surgery. So, kind of why we wanted to bring this up was, to let everyone know kind of how far that has come. So in the picture that I have here, the instrument is kind of cutting the yellow brownish cataract. Having cataract surgery, then the cataract will be removed, the natural lens will be removed, and you must have an implant to have the refracting power of the eye so that you can see clearly. So that is the implant. Then after cataract surgery, what to expect is a lot of times you have to use eye drops to prevent infection, decrease inflammation, and sometimes to control other things. Recent advancements in cataract surgery enable us to have cataract surgery and no drops afterwards. The surgeon may use a medication and put it inside the eye so that you have to use less drops after surgery. So that's a nice advancement in that technology of the surgery. And I just put the picture of the woman with the patch because it is important to have an eye shield on after the surgery, at least during the nighttime, as far as rolling over and rubbing your eye or bumping your eye right after you had the surgery. So those are just a couple things to expect after the surgery. If you're having an exam in our office and we're recommending cataract surgery, we have other things that we can kind of give you other information about what to expect, and obviously the surgeon has information for you as well. And then following cataract surgery, you will usually see improvement in your vision, the next day. It'll already be much improved. There will be a period of healing, and so your primary care, your optometrist, will need to see you, or the surgeon will need to see you 1 day, 1 week, 1 month, and usually 6 months after cataract surgery. So those follow-up appointments are just important to make sure that there's no infection and that you're healing properly. And then after cataract surgery, we recommend no heavy lifting or bending that might, displace that lens implant. And then you may return to work relatively quickly, and it's usually an relatively easy recovery. I should have added here too that we operate on just one eye at a time, about a week apart. So we kind of make sure that first eye is healing properly, and then usually the second eye then will be a week or so later. And the advancements in the surgery are different types of implants that we can put in, and that's what is new and exciting also with cataract surgery. Ways that we can further improve your vision. So the first lens implant that I showed you was a basic implant that will definitely clear your vision. And sometimes you don't need glasses after cataract surgery because that lens has your prescription in that. Sometimes you still need glasses, especially for reading. Sometimes there is a little bit of prescription left. And these specialty lens implants, the ones showing here, is for astigmatism. So if you have a high amount of astigmatism in your prescription, the surgeon can actually use this lens. It has some little dots on it there. I don't know if you can appreciate that, but that is how the doctor lines that up during the surgery, and that will cause you to have less astigmatism in your prescription after surgery once everything is healed. And that this lens may then further reduce your need for wearing glasses after the cataract surgery. And then also, very exciting new technology that we have is a multifocal lens implant, which is like a bifocal. Multifocal just means many points of vision. So not just two in a bifocal, but many different points of clarity. So in this implant, you can see that there are little rings here on the implant, and each of those rings has kind of a different prescription built into it, and that helps us to be able to see far away distance objects and to read up close following cataract surgery. So this lens is designed then to help reduce the dependence on glasses after cataract surgery. This does take some time to kind of adjust to. But some of our patients then require no glasses for driving and also no glasses for reading and up close tasks. And so that's really exciting, this option. This sort of implant, it does have extra fees associated with it, but a lot of our patients do choose that for the possibility of having to wear glasses less after cataract surgery. And all of the lens implants will definitely remove the cataract and help your vision, but it is nice to have these new technologies and exciting things, that you might be able to help further clear your vision and see better in 2020. So that concludes our presentation today.
Dr.
And if anyone
Klein,
has any
for your
questions.
preparation and your time with us this evening. If as mentioned, I think it's universally recommended that eyes be checked annually. Is that the right thing? And so if our eye and vision team can help you with that, look us up at KSB Eye and Vision on Palmyra Avenue, 815-284-2020. Easy number to remember. But thank you for your time this evening. We will be doing additional programming on census-related topics. You can find out about those by going to ksbhospital.com /events for a schedule, and also can see previously recorded tapes of other events that we've done. Have a good evening and thanks.